Assalamualaikum warahmatullahi wabarakatuh. My name is Dr. Norkhairin and I am your medical officer today. So can I know confirm your names and also your IC number?
My name is Nurmatisha binti Muhammad Zahra and my IC number is Delene.
Okay. So for today, I will do the cardiovascular examination. Do I have your consent for doing this examination?
Yes.
And do I have your consent to some of the part maybe be touched and also being exposed?
Yes.
Okay. So I will start your examination. Okay, so do you comfortable?
Yes.
Okay, so no sweaty, no breathless. Okay. Now respiratory rate. Okay. Breathe normal. Okay, your respiratory rate is normal.
This patient appears comfortable at rest, not tachypneic and not in a respiratory distress, suggesting hemodynamic stability. I also inspected for oxygen supplementation, intravenous lines and cardiac monitoring devices which may indicate severe underlying cardiovascular disease.
Okay, now I will check your hand. Okay, may I look your hand?
Yes.
Okay, so your hand. Okay, first, there is no peripheral cyanosis. There is no splinter hemorrhage. Okay. There is no tendon xanthomata. Okay. I feel your hand. Okay. There is no ostenoids. There is no genu lesion, and there is no palmar erythema. Okay. Can you do left? Okay. So there is no clubbing. Okay.
I examined the hands for peripheral stigmata of cardiovascular disease. There was no finger clubbing which may be associated with cyanotic congenital heart disease or infective endocarditis. There were also no splinter hemorrhage, ostenosis or genu lesions suggestive of infective endocarditis. No tendon xanthomata were seen, reducing the likelihood of the severe hyperlipidemia. Capillary refill time was less than 2 seconds with warm peripheries, indicating adequate peripheral perfusion.
So now I want your wrist. I want to check your wrist. Okay. So I will check your just relax. Okay. Okay. So okay. So your pulse rate is normal. Your rhythm is normal and your volume is normal. So can I check your other hand? Okay, there is no radio delay. Okay, no collapsing pulse. Okay, good. Okay, no radiofemoral delay.
The radial pulse was regular in rhythm with normal rate and volume. A regular pulse reduced the likelihood of the arrhythmias such as atrial fibrillation. There was no collapsing pulse suggestive of aortic regurgitation.
Now, I will say your eyes. Thank you. I will. Okay, look at up. Look down. Okay. There is no conjunctival failure. There is no jaundice. There is no corneal arcus. Okay, no xanthelasma. Okay, there is no malar flash. Okay, can you open your mouth? Okay, your mouth. Okay, there is no. Okay, your oral hygiene is good, and then there is no dehydration. Okay, and then there is no central cyanosis, and there is no Marfan syndrome. Okay, good.
I examined the eyes and the oral cavity for cardiovascular related abnormalities. There was no conjunctival failure to suggest anemia and no scleral jaundice suggestive of hemolysis. No corneal arcus or xanthelasma were seen, making significant hyperlipidemia less likely. There was no central cyanosis indicating adequate systemic oxygenation.
Okay, can you turn to the left? Okay, good. Okay, good. Okay, now I will check your jugular vein pressure. This is your semen. Alright, so your GVP is normal. Okay, now your hepatojugular reflex is normal. Okay, now
The jugular venous pressure was not elevated. JVP reflects right atrial pressure and help assess volume status and right heart function. A normal JVP reduces the likelihood of right side heart failure, fluid overload, and pericardial disease.
I will check your. Okay, no, there is no surgical scar at your chest. There is no any of deformities in your chest. Okay, there is no abnormal palpation, and also there is no displacement of the apex beat.
I inspected the precordium for surgical scars, chest deformities, and visible pulsation. There were no sternotomy scars suggestive of previous cardiac surgery and no visible abnormal pulsation.
Okay, now I will check your. Can I touch?
Yes.
Here. Okay, there is your apex beat. It sounds normal, and then your apex beat is in the correct direction. Okay. Okay, your parasternal hip ventricle is normal. Okay, now I will check your sound.
The apex beat was located at the fifth intercostal space middle to the mid-clavicular line, which is the normal anatomical position. There was no displacement to suggest cardiomegaly or left ventricular dilatation. There was no parasternal heave, reducing the likelihood of the right ventricular hypertrophy. No thrills were palpable, suggesting absence of severe valvular pathology.
Okay, I will check your. I will touch your chest. Okay, now. Okay. Okay. Okay, your mitral valve is normal. Okay. Your tricuspid valve is normal. Okay, pulmonary valves are normal. Okay, aortic valves is normal. Okay, now can you sit? Okay, sit. Okay, now breathe like normal. Okay. Okay, there is no early diastolic murmur.
On auscultation, normal first and second heart sound were heard with no added sounds or murmurs. There were no features suggestive of valvular stenosis or regurgitation. No third or first heart sound were appreciated, reducing the likelihood of ventricular dysfunction.
Okay, I will check here. Okay. Okay, your aortic arteries is normal. Okay, now I will check your back. Okay. Okay, no bibursal crepitation. No sacral edema. Okay, and lastly, okay, there is no pedal edema.
There were no bibursal crepitation to suggest pulmonary congestion secondary to heart failure. There was no bilateral pitting pedal edema, reducing the likelihood of congestive cardiac failure.
Okay, for the summary, your cardiovascular system is in a good health and is in a good condition. So that is all. That is the end of the CVS examination. Thank you for your contribution.
In summary, this patient was comfortable at rest with no peripheral stigmata of cardiovascular disease. The pulse and jugular venous pressure were normal, the apex beat was normally positioned, and the heart sound were normal with no murmurs. There were no signs of cardiac failure such as bibursal crepitation or peripheral edema. Overall, these findings are consistent with a normal cardiovascular examination.